Hello everyone, this is the final project presentation of HAP671 by Tahrin Afrin. Fast facts on diabetes. 11.3% of United States population, which is around 37.3 million people, is diabetic in United States. Among them, 28.7 million people are diagnosed and 8.5 million people are undiagnosed. For this project, a simulated data was used which contains unique patients and records. Now, the definition of diabetes. Diabetes is a chronic, long-lasting health condition that affects how body turns food into energy. There are two types of diabetes, type 1 diabetes and type 2 diabetes. In this data set, the obvious predictors, which has 29 frequency, and rare predictors, which has more than 30 frequency, are used. Then obvious predictors of diabetes are listed on this slide, which are diabetes mellitus without mention of complications, diabetic ketoacidosis, diabetic nephropathy, diabetic ophthalmopathy, diabetic neuropathy, diabetic coma with hyperosmolarity, diabetes with peripheral circulatory diseases, diabetes with other specified manifestations, diabetes with unspecified complications, and diabetic foot ulcer. These are some rare predictors of diabetes. Benign neoplasm of uterus, anal and rectal conditions, otitis media and other related conditions, other infections including parasitic infections, other acquired deformities, miscellaneous mental health disorders, retinal detachment vascular occlusion, other and unspecified benign neoplasm, inflammation and eye infection, acquired partial abscess of pancreas. Important and uncommon predictors of diabetes. Essential hypertension, disorder of lipid metabolism, acute and unspecified renal failure, coronary atherosclerosis, esophageal reflux, atrial fibrillation, anxiety disorder, COPD and bronchiectasis, anemia unspecified, and hyperplasia of prostate. For this predictive model, naive Bayes theorem was used for data mining. Naive Bayes is a classification algorithm which uses Bayes theorem for probability of the prediction of an unknown class. Here's for example, we have used the patient ID 457631. It shows the likelihood ratio and the ICD-9 codes. And after multiplying the 5 likelihood ratios, the odds of diabetes are 0.079 for this specific patient. For the cross-validation of data, the data was divided into two sets randomly. One is training data set and another is validation data set. 80% were the training data set and 20% were the validation data set. The receiver operating curve determines the accuracy of the model. I have plotted 1 minus specificity in the x-axis and sensitivity in the y-axis to determine the receiver operating curve of this model. Sensitivity is the true positive and specificity is the true negative in this case. I have also calculated the total area under the curve, which is 0.910869565. Real-world use of this predictive model. A diabetes prediction model can assist medical providers in identifying those who are at risk of this condition, enable early treatment and better management. Better health outcome and lower healthcare expenditure may result from this. This is Tahrin Afrin. Thank you so much, everybody.